Thanks to women like Kim Kardashian, Jennifer Lopez, and Beyonce, bigger behinds are becoming a must-have trend. But are they safe? Today, an urgent warning on a new cosmetic procedure leaving women in severe chronic pain, even threatening their lives.
It's spreading from the stars of pop culture, celebrities promoting bigger behinds, to everyday women on the street. But butt implants and fat transfer procedures can be costly. So Sophie opted for less expensive silicone injections. Injections that immediately made her sick.
I started to lose my breath a little bit. I felt like I was gonna pass out. My heart started to race like really, really fast. I honestly thought I was gonna die.
It wasn't until after her injections that Sophie learned her doctor wasn't licensed. She says the fact he was working out of a house and not a hospital should have been a warning sign.
A part of me thought, you know, what if something goes wrong, of course. Then again, I seen my friend do it and she was perfectly fine. And I thought I was untouchable and I thought, you know, nothing can happen to me. But I was wrong.
Over the next year and a half, Sophie's symptoms became worse. Eventually, her breathing became so impaired, she feared for her life.
I was afraid to fall asleep because I felt like my lungs just stopped working when I fall asleep. I knew it was the injections because prior to the injections, I've never been sick. I was very healthy. My breathing was great. I mean, after the injections, my whole health just went downhill. I've been to the hospital over 30, 40 times. The worst part was just thinking that maybe I'll never get help and that I just have to prepare myself to die.
It's pretty scary, Sophie.
It is.
So you mentioned that the procedure was in a house, not in a doctor's office.
Right.
Did you have any reservations when you realized that?
In the back of my mind, I knew that, you know, not everything was supposed to, you know, look like that. I don't know. I just felt like a part of me was just thinking that maybe, what if something goes wrong?
Why'd you not listen to that gut instinct? Women have such a powerful sense of what's right.
Yeah. I just wanted, you know, to have that surgery done so bad. And, you know, I've been doing a lot of research and I just went for it.
There's a lot of pressure on women to look
There is.
perfect,
Mm-hmm.
to look maybe the way they don't look.
Right.
Did you feel that?
Yeah, I mean, watching TV all the time and seeing all these perfect Barbie doll looking girls, of course, it definitely pressured me to do that.
Well, stay right here, because I want to make sure that women aren't making bad decisions because of that pressure.
Of course.
I asked Dr. Michael E. Jones to be here. He's one of the busiest practitioners in the butt enhancement field in the country. Now, I have been stunned at how much we're seeing these bigger butts become part of the zeitgeist, part of what we all think. But now I'm seeing relatively innocent women feeling that pressure and taking big risks. So please show everybody, we have a bunch of substances in front of us. What's actually being injected and what is this foreign material that's being used to bulk up the behinds?
Well, that's the problem. When you go somewhere that's not a medical office, you don't know what you're getting. You don't know if you're getting vegetable oil. You don't know if you're getting injected with baby oil. You don't know if you're getting injected with
I
silicone.
use this in the kitchen.
Absolutely.
Silicone, cement, mineral oils, car oil, they use that too?
Even car oil, even cement is sometimes injected. And that's what these butts will feel like as the healing process occurs at times.
Let's show everybody what's actually happening inside of the female body when these are injected. I'll do the crazy, wacky stuff that's happening, and you tell me how it should be done, all right? Okay. So let's rotate the body, and you take a needle and you inject it into this gluteus muscle area here, and then you infuse the substance. Now, if it's a material that's not supposed to be there, it doesn't stay where it's supposed to stay. It slips away to the back of the thigh, to the back itself, and it forms scarring, which is important, but it also causes inflammation in the body, which is, Sophie, why I think your life was at risk. Your lungs are getting beaten up because your body was reacting to this foreign substance in that it's not supposed to be there. But there is a way to increase the size of the buttocks that does work.
That's right. And taking autologous fat, your body's own fat, not a foreign substance, taking it from your abdomen, taking it from the sides, taking it from your back, or even from your thighs, and putting that into the gluteal area can really give a nice enhancement to the gluteal area.
and it doesn't move.
Exactly.
And your body's not going to run away from it. So as opposed to this scarred, beaten up, inflamed area, you get the cosmetic result you want, but you're also getting it safely. And it's a twofer, right?
It's a twofer.
You lose the fat around the belly, and then putting it where you want it, which is, I think, a surprising way to go. We'll be right back with Michael in a second. So the team of doctors at Lennox Hill Hospital was able to remove the silicone from Sophie. So take a look.
Our technique does not involve spreading the silicone. The most important thing is removing the foreign material and getting the patients healthy. We're doing this in a staged manner, where the first operation is going to allow us to debulk and reduce the foreign body burden, and then allowing us to take advantage of the resources that we have and use a special device that will suck out the liquid silicone and any bacteria that may be in there, while allowing us a second opportunity to go back in, remove any more foreign body, and then perform a buttock lift, which will hopefully give a cosmetically acceptable result.
Sophie's doctor is here. Dr. Mir, how successful was that operation? And thank you for doing it.
Thank you very much for having me. Sophie's surgery was incredibly successful. It's been exactly 6 months since we operated on Sophie, and she hasn't been hospitalized once. And both of her surgeries that we did at Lennox Hill Hospital went very smooth without any complications. She was very compliant.
So I want you to talk to everyone in America who's thinking about having these, in this case, butt augmentation procedures, but any plastic procedure. They're thinking of doing it in an unsafe way. What do you have to say to them?
First of all, just love yourself. Just don't go by what you see on the media. Learn how to just look in the mirror and love yourself before you go and do any cosmetic procedure. And before you go do any cosmetic procedure, just make sure that that doctor is in fact a licensed cosmetic surgeon.
You know what, I'm gonna take that little advice from you and take it to one step further, because I think it's really important. But you got the first part beautifully stated, and better than I could ever state it. So thank you, and please trust the Dr. Mirs of the world.
Oh, he saved my life.
Now, I'm going to ask Dr. Jones to stick around and to follow up on what Sophie's saying. There are 3 things that you have to ask a doctor before having any cosmetic procedure, so stick around. Today's show is all about the medical mystery cases you'll be talking about tomorrow. Now, you just heard the horrific story of when a cosmetic procedure goes wrong. I don't want it to happen to you. So Dr. Jones is back with us. He's got the 3 things to ask your doctor before having a cosmetic procedure. He says the first thing you got to do, ask this question, are you board certified? How can someone be sure if that answered is correctly?
Well, there are several board certifying organizations, the American Board of Plastic Surgery, American Board of Facial Plastic and Reconstructive Surgery. There are countless boards, but what the patient should do, or the person interested in having surgery, they should go to those websites. They have databases. People can even look for this information on their cell phones, but it's very important to find out if your doctor is certified or not.
All right, second thing you want you to ask is, am I the right candidate for this particular procedure? So how do you know if you're suited for what's being offered?
Well, let's face it, not everyone is suited for plastic surgery. These are elective procedures. These are procedures that you may want to have, but you don't have to have. Luckily, we have 3D imaging technology now that can kind of give you a sense of what you could look like in the future after having plastic surgery. I don't like to use this in my own practice because I think it gives people a false impression, but it is a window into what you could look like. And I think, now we all know that Dr. Oz is probably one of the hottest men in America, right?
Oh, please.
But
the bad news is coming now.
And it's kind of hard to correct anything with him because he's absolutely perfect, right?
I wish my wife was listening.
We do have, I believe, a picture of you on this 3D imaging device.
Oh, there I am.
There it is.
So how does this? So I'm not so perfect. I got bags.
Well, listen.
I got all kinds of stuff happening.
As we age, we all age. And one of the things that happens as we age is our cheek muscle and our cheekbone actually recedes. And as it recedes, the skin around the lower eye starts to hang. And so you can see that there's a little extra skin and there's some puffiness. Some of the orbital fat or the fat that houses the eyeball is starting to prop forward.
Sounds worse and worse.
I know, I'm sorry.
I thought you weren't going to fix perfection. Now
this is all perfect. So what we're going to do, we're going to take this eye area and give you a sense of what it would look like if you had a blepharoplasty.
So you circle it with your imagery.
That's
it's gone. Ooh.
Now look at that.
I like that a lot, actually.
So maybe taking off maybe 10 years or so. Just by that.
Yeah, can you make me look like Jay Leno?
Oh my goodness. Let's see. Let's take this chin here. We're going to elongate it a little bit. Let's have some fun. Look at that.
That's it. I tell you, Lisa was going to love this.
All right.
Okay. When can you do it?
Next week.
Next week. All right. All right. What do you guys think? Which one do you prefer? This one, this me? Or do you prefer this me? All right, I got a reprieve. All right, come on, Dr. Jones. The last thing we're going to talk about, and this is a question you have to ask, is what complications should I expect and how many people get them? Don't just ask the complications. It's a laundry list. Ask how often they occur.
That's right. I mean, hematoma, bleeding into the area can occur. Yeah. And you want to know not just that it can occur, but how often can it occur? And how often does it occur in the hands of your doctor?
Right.
Nerve damage is also something that can occur. Infection can occur.
Yeah.
Infections can occur in any surgery, but specifically in butt enhancement surgery. And the appearance and dissatisfaction. People have to have realistic expectations of what they're going to achieve. If you go in thinking you're going to achieve something that is not real, you're going to be dissatisfied.
Thank you for the wonderful advice and for the offer to fix my bags. I appreciate it. Check out droz.com. We're going to actually have a wonderful example of how you can learn more on the web. 3 of the most common cosmetic procedures are going to be outlined and the most common complications they can cause as well. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.